Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we welcome Jodi Fenner, Executive Vice President of Execution and Growth at TCARE, a transformative leader driven by passion for caregiving and a remarkable journey across law, accounting, and healthcare. With vast expertise in healthcare innovation, governance, and support system for caregivers, Jodi has been instrumental in redefining caregiving through clinically proven framework at TCARE. Beyond professional achievements, Jodi embodies a deep commitment to mentorship, family, creating value in every leadership role. Join us as we delve into her story, impact, and vision for healthcare's future. Welcome to Health Tech Heroes, Jodi.
Thank you. Thanks for having me.
Have had an extraordinary journey from legal and accounting roots to healthcare leadership. Can you share some emotional turning point? There are some logical decisions, but sometimes you end up buying an idea because of the emotional reason for it. Is there an emotional journey or an incident that you can share with us, Jodi, today?
I would say this is probably true for most of our executives here at TCARE and most of our staff. We all have that caregiving background. I know what it's like to have a grandfather who was a Purple Heart veteran, really wanting to live in his home his entire life. Really felt very strongly not wanting to move into a nursing home, and watching my family and supporting my family and wrapping around him to be able to spend his last days in a very respectful way that he had planned for himself. That was me. And I want others to have that opportunity. And then today I have a father who is a disabled American veteran. I have a mother who is dealing with her own struggles and at the same time want to be a supporter for them, but want them to have that dignity and respect that they deserve for the life that they've built for themselves and others. And I feel like we do that at TCARE. We're not here to take care of people necessarily. We're here to walk alongside caregivers and help them do that. And so I think when I think about, you ask personal stories, why am I here at TCARE? Why am I in this industry? It really is that ability to impact people and their families. And I had that same experience when I worked in legal. And you're right. I mean, there is no, how did I get from being legal counsel for a state human services agency to now I'm working in a caregiving industry? And it really is just about being in that right place at the right time and having that opportunity to support people and living the most independent lives that they can. And that is something I'm very passionate about.
That is great story. The reason is you have a legacy, your family has a legacy of serving the country and then now serving the patients. Now you are serving the people who serve. So there is always a layer of serving and serving and serving. And thank you very much for that.
Oh, thank you. I appreciate it. And technology does play a big role in that. You talk about health tech and how critical it is. What we're learning here at TCARE and what we've learned in the last 5 years, we're not a new company. We've been around for a while. Evidence-based protocols were credentialed by the Administration on Community Living in 2014. But what we've done really is how do we use technology to support families and their caregivers at the time that they want and in the way that they need, and really connecting them to the resources that they need. And so at TCARE, what we've really done, especially in the last 5 years, is really enhance the technology, utilizing things like AI functionality, but in a way that is safe, right? We all hear AI, we all hear tech. And I mean, the first thing my parents want to do is throw away whatever technology you put in that home. They just soon, my dad still has a flip phone. But the reality is that caregivers, they don't work 8 to 5. They caregive around the clock. They need access to resources at 2 o'clock in the morning. They need to know that even though we're using technology and AI to connect them to resources based on how they engage with our tech, that they're trusted resources. So what we really are passionate about here at TCARE is making sure that what we deliver is safe and secure for that caregiver, because in today's world, technology, quite frankly, can have a lot of risks. You hear horror stories every day, especially in the aging area, about technology gone awry or things not working in a way. And I think what's really different is even at our IT level, Ashok, our head of IT, everything, he runs product IT for TCARE. He came to us as a caregiver. He's not here because he wants to be in IT. He literally had a very successful company that he built and sold. And then he was a caregiver for his family member. And he came and he said, I know what caregiver, I mean, he really brings that caregiving component to TCARE. And so you see that in our tech, in our enhancements to our protocols and our outreach. It's really changing decades old language and bringing it up to modern day person-centered approaches, being very culturally responsive and being responsive to the fact that caregivers come in every different age, color, background that you can imagine. And we have to make sure that our tech is flexible to that, as well as our personal approach, our TCARE specialist. And really that is what we do, is we merge the tech resources with that human one-on-one support. And we're able to design that and implement that because our leaders have that experience and know what it's like to be a caregiver.
We have not spoken about the advantages of the technology very specifically, but in your mind, the risk was at the forefront. So I want to dive a little bit deeper into the risk of it. Can you explain what kind of risk technology can bring to the industry? Any examples?
We work a lot in the aging and disability space, people who are older or have disabilities who need caregivers. And quite frankly, that population is a target for identity theft, which, technology is driving a lot of fraud and identity theft out there today. And so what we have to do is make sure our programs at TCARE or any health tech company, that as we're deploying, we're doing it in a way that is hypersensitive to individual identity and safety. For example, we work with a lot of managed care organizations, and they have predictive analytics, or we work with our predictive analytics and we identify populations that are at risk for not being able to live in their homes long term. They might be at risk of nursing home facility placement or a behavioral health facility placement. And they want us to step in, outreach to those families and connect. Well, even with caller ID, identifying who we are, sometimes we're talking to caregivers and they're thinking, oh, well, how do I know you're real? And so that is it. So we have to think about how we interact with families and caregivers, that technology and the assurances that the information that they share with us is protected, both technologically and otherwise, that their privacy is protected. And then because we do use AI and we want to, right? You have to, it doesn't make sense not to use technology to connect people with resources today. I can do with AI in 1 hour what used to take 8 or 9 hours. For example, we had a caregiver who needed a unique resource that wasn't covered by health insurance, that wasn't covered by anything else. And we were able to use our AI bots to locate the specialized equipment. There was a program that actually, a weird little unique program that provided that. But we have to make sure that as we do that, we're connecting to trusted sources. And that's what families want to know. You're not just going to throw tech out there and connect them to anything out on the web, right? Because that can be really dangerous, and that can set older families or people with disability or people who are in a vulnerable state. It can set them up for things like identity theft or just theft, period, access to your computer passwords and things like that. So I think it's really critical that we are able to talk about how our tech is safe, that it is secure, and how we engage with families, that they feel comfortable and they know that those risks are being mitigated.
When I heard the word risk, I thought was going to be more or less like, there will be a population that will be left behind if we advance our technology too fast. But you're also saying that there is a huge risk in identity theft if you expose people to too much technology as well.
Right. There is a risk of being left behind. I talked about my father. He is never going to get on a platform like TCARE and navigate himself. And that's really why our mix of human with targeted technology is so critical. You can't just do the human. You can't just do the technology. It's really imperative that we merge the two of those, because otherwise you're correct, leaving people behind, that not everybody has a computer, not everybody has the internet. And we don't like to think about that, but here, even in the United States, there's a large area, rural areas that don't necessarily have the access to either the tech or the equipment. So we have to be thoughtful about how we deploy that.
That's fantastic. And one of the philosophies that I want to pivot before we get more deeper into TCARE discussion, you have written on your LinkedIn profile, we do well by doing good.
Yeah.
And can you tell us what do you mean by that?
Yeah. So it really is about you can do good things, put good out into the world, support others, and still be successful and profitable. And we always put our families and caregivers in front of everything that we do. When we were enhancing our new digital platform, that was really what we were thinking about, is what's important to the family and the caregivers. And instead of just thinking about the profit and the business perspective, we always try to think of the end user and those families in everything we do. And by doing that, by doing the right thing for people and the families we support, we are able to credibly and successfully grow our company, quite frankly.
Very specifically about the TCARE, caregivers are ultimate end users, but who are your customers and what is the offering of TCARE?
So we have a broad array of customers. We work with insurance companies, managed care organizations. We work with community-based organizations like area agencies on aging. These are local community-based organizations in almost every community in the U.S. that support family caregivers through Older American Act and other federal funds, and also state funds as well. So we work with those managed care organizations and their insurance products. We also work with providers, skilled nursing facilities, hospital systems. We have a professional caregiver product, and this is relatively new at TCARE. What we found in the last, and this isn't news to anybody who works in the industry, the lack of professional caregivers and the turnover of professional caregivers has really impacted the capacity of our health systems. And that came to TCARE because our family caregivers were stressed because they couldn't access the services in the community. And so we expanded our evidence-based protocols to really look at those professional caregivers and how can we work with employers and reduce that turnover. I was looking at some statistics. There was an article that came out in the last few days that talked about a very high number of the workforce are caregivers today, and almost 25 to 45% of caregivers will leave the workforce because their caregiving duties become so high. And in the healthcare industry, if people are leaving the workforce, those are fewer people to support our loved ones to be able to live at home. So and what makes TCARE different, it really is that mix of quality high tech and that human component of our TCARE specialist teams. We are flexible and fluid from our technology perspective, but we have that true human component that supports the caregiver in their needs. And we are able to, what differentiates us isn't just what we deliver. And I mentioned this, but we're not new. There's a lot of new caregiving organizations. We've been around for a while. We've enhanced what we do, but and a lot of the tech that we're doing is new or in the last 5 to 6 years. But that dedication to caregivers goes back to our founders. Our founders were a small group of people who were caregivers for their parents, and they really saw the potential to grow a system of that support. And today, we are able to have real outcomes. Our nursing facility diversion rates are significant. We're able to help support family caregivers, keep them in their home. We are able to close care gaps for people who are experiencing that. And that might be a situation where they're having challenge accessing their current approved resources or authorized services. It could be that they haven't found the time to take care of their own personal preventative health. And so by wrapping around our caregiver support system, we can close those care gaps in partnership with the families as well as our customers.
So when you talk about professional caregivers, is there any specialty where you have more turnover than other specialties? Because the first thing comes to mind is caregivers who have specialized in mental health care might have a different level of challenges compared to other specializations. Is there a more turnovers somewhere?
Absolutely. When you get into the more challenging situations, I would say, caregivers working in the developmental disability space and the mental and behavioral health space, those are really challenging, and the mental load that they carry is so high. And the other thing that we have noted significantly since COVID is those professional caregivers also are caring for their family. And so across our employer products, across all of our products, what we're noticing is those family caregivers are really struggling with the mental health of their children, the mental health of their aging parents and their other family members. And so it's like that they're getting it from every angle. They're caring for very challenging situations at work, and then they come home and they don't get a respite. They don't get a break because it's that almost same challenge they see at home. So that's a big population. And in some of those provider industries, turnover rates are over 60%. So you can imagine the benefit of a provider working with somebody like TCARE to reduce that employee turnover. And our average turnover improvement rates are around 35% right now. It gets a little higher when you're talking about direct care staff. Area that I think is really critical, and this really got hit during COVID, is our skilled nursing facilities and our home health and hospice areas. Those providers went through several years of intense challenges dealing with a smaller workforce, working with individuals who were very isolated, and then also trying to support caregivers who weren't necessarily allowed to see their loved ones because of COVID. Now we are coming out of that, but there are still a lot of, it's almost like we have PTSD from COVID, and we still have not seen that workforce bounce back. And so we have a workforce that is there who is really trying to do the work of that missing workforce. So lots of opportunity to support those professional caregivers, and in return expand community capacity, which then allows people to get quality services and supports in their home and communities.
So I can imagine everything a caregiver is going on. And you said there were like 30 to 40% of people workforce is actually also caregiving. So that's a significant population. I did not realize it was that high. So for people who are in caregiving industry, the percentage is going to be the same. So there's 30% to 40% of caregiving, professional caregivers are also going back home and caregiving. For TCARE, is there a win that is close to your heart that you want to share with us, saying that, hey, this was something that TCARE did and only TCARE could have done this, and I'm proud of this?
My gosh, I could talk about that for hours. We had a situation this last month, and this is probably par for the course, but it really touched my heart. We have this grandmother who had adopted her grandchildren, and they had come through the child welfare system. Brother did a kinship adoption. The children both had some special needs, behavioral health specifically, and then all of a sudden this caregiver was diagnosed with terminal cancer. So now she's terrified these kids could end up in the system again. You know, she's got a plan for how does she maintain their stability. And through this process, they lost their home because the cancer treatments were expensive. There's just a lot of financial challenges. And so our care team was able to wrap around. We always work with social emotional supports because with caregiver supports, identity discrepancy and just emotional stress can be high. But so many times what we see is there's real economic needs, and this family needed help finding a temporary home. We were able to connect them to some fantastic resources in their local area, including there was some really great things from the Gilda Radner Foundation in Florida, and they do some amazing things for a family with cancer. And so we were able to help this grandmother, who was now a mother to her grandchildren, deal with some immediate economic needs, housing, food, just basic home security for the family. And that allowed her to take proactive care of her health. It made her, it helped release some stress. It helped her more adequately respond to her cancer therapies that she needed. And then what it really also did, by reducing that stress, we're able to talk to her about, so you might not be here forever. Let's take care of you. And in this process, we'll talk about how we can make sure the children are always taken care of. Opening up that circle of support to other family and community members so that she isn't alone and she knows those children won't be alone. This woman has a long journey ahead of her. This is not a thing that was solved by any stretch of the imagination, but to know that she has the TCARE team behind her along with her local healthcare team, it was really touching. What we hear from caregivers all the time is, yes, we need all of this stuff, but sometimes they also just need to be heard. And that was definitely something that we got out of that. So it's a recent example.
Patients have the highest visibility in a healthcare. Healthcare providers also have visibility in the healthcare. And so when you go to a commercial entity and say that, hey, you know what, you need to be our customer so that we take care of the caregivers, what kind of pushback and where this pushback comes from?
I think the biggest challenge is so many organizations have so much going on right now. There's a lot of cuts coming at the federal government level, so there's funding insecurity for organizations. Everybody knows that caregiving is the right thing to do. I mean, there's a reason you can't look at Yahoo or Google without seeing a caregiver story every day. There's so many good focuses on that. But actually investing in those caregiver resources so that you can see those long-term successes is hard for a company. The other thing is as our systems of care, we've done some pivoting that says we know if we take care of social determinants of health for people, that's those social and economic needs. And then if we do also caregiver supports, that we know we have better health outcomes and social outcomes for both the individual that's being cared for and the caregiver. But not all programs are set to fund that caregiver support. For example, we're working with some managed care organizations in a West Coast state that I won't name because they're a fantastic state, so I don't want to put anybody on blast. But they've done this great new update of their Medicaid program in the last 5 years to include some caregiver supports like respite, some limited training, housing, and some of those social determinants of health supports, but they aren't necessarily funding that connectivity to that. And so working through those systems of care and those programs to identify how do we bring this support to families in a way that it can be funded, because obviously caregivers themselves can't necessarily fund that themselves. So that's that challenge is everybody wants to do it. They know it's the right thing, but where do we find the right funding source and how does that fit? Luckily, we have a great team here at TCARE. We can sit down with folks and we can help them design. Okay, so these are your funding sources that you use today. Are there ways to bring something in as like an in lieu of service or as a quality improvement project? There's different ways that you can fund caregiver supports that we just haven't done in the past. And so we have to think outside the box. And we bring that support to our clients.
So that's pretty amazing that you also support the clients to figure out where the funding comes from. And the other thing that I had not really wrapped my mind around was we do not have a clear KPIs for the patient outcomes based on caregiving. We have pretty good KPIs for, hey, doctor prescribed this drug. So we have a positive patient outcome. So we have KPIs for that, indexes for that, but we do not have a metric for caregiving, or do we?
We do. And again, this isn't necessarily true for all caregiving programs. We've been around for a while. So even before we were engaging with our managed care partners and working with them to calculate ROI based on claims data and things like that, we do part of our evidence-based screening and assessment and our caregiver protocols. We measure things like caregiver burden. Our protocols look at 90 different aspects of caregiving, and then those boil down into 6 caregiver burden categories, and then those are scored. We also look at intention to place, and we track that against caregiver burdens. And I think our most recent numbers is over 85 to 89%. It ranges depending on the area of the country and the population. But of those, we are able to, within 3 to 6 months of engagement with our program, able to reduce or maintain those burden scores. So we do have an actual burden score that we use. So that's TCARE independently. But now that we've had this multi-year engagement with our managed care organizations, because I will say our managed care organizations have been leaders, I think, at really understanding and investing in caregiver supports, even when it wasn't being funded by Medicaid or states. So I'm very blessed. I think we've got a lot of great managed care organizations leading out there. And so what we've been able to do in the last 3 years is take that claims information, we collaborate with our managed care organization, and we say, okay, this is what we have accomplished for the caregivers. How does that translate to cost savings and avoidance? And we, like I said, we There were some presentations at the HCBS conference last year where we had some really strong statistics that our managed care organizations shared. We do respect their privacy. Managed care organizations are highly competitive, so I'm not going to share any individual statistics from our company partners. I would have to have their authorization to share that. But what I will say is, generally, what we see, we talked about gap closure. We're able to increase that HCBS utilization by anywhere from 10 to 20%, depending on the program and population. And then what we've seen is a significant reduction in ER and inpatient utilization and nursing facility utilization, which means we're getting people the care they need at the home. That's the HCBS component. And objectively, using those KPIs, the outcomes that we track are the reduced inpatient utilization, nursing facility diversion, and overall cost of care. And that can range anywhere from 7 to 30. It just depends, again, on the population. So we do track that. And then within our programs, we track things like, we don't just do an assessment when somebody enters the program. We redo that every 90 to 120 days. So we can see how caregivers are improving. And we have a goal for that. We want to see at least 70% of caregivers participating in our program either improve their caregiver burden scores or maintain them. And when I say maintain, you say, well, how does that help? If they're maintaining, you haven't really done anything. And that isn't true, because we work with families who are supporting people with dementia, with long-term disease and disabilities. That caregiving job is never getting easier. And many times it is getting harder, especially in our dementia programs. So if the caregiving challenges are getting harder, but you're able to maintain that static level of support, then that's a win, quite frankly.
Yeah.
Yep.
Where do you think caregiving and technology and healthcare is going to meet, like in about 5 to 10 years? What do you think is going to be a dramatic shift? What are we doing now and what we should be doing so that we make sure that 5 to 10 years we are in a good place?
I love that question. So our focus, and I think the industry's focus to date, has been on how do we use technology to better deliver supports. I think the next step is we have to offer more training and supports to caregivers of how can they use technology to make that caregiving job a lot easier. There are so many great innovations out there, remote support technology, home safety mechanisms, things that used to be, having a smart kitchen 10 years ago was at a minimum a $20,000 engagement to have sensors and things put in place. Remember the old, well, you might not, in the autism and developmental disability world, the old Dynavox was thousands of dollars, and now we can do the same thing with a $300 iPad. But really helping families use technology in a way that meets their needs, I think that's really the next step when we talk about technology and caregiving. Because caregivers are overwhelmed. They don't have time to research what's on the market. They don't have time to necessarily embark on, I'm going to learn this new technology. I'm going to learn how to use this just in case it helps. They don't have that kind of time to spare. So we have to do that orientation and awareness and education for and with them.
We have to do it proactively, because they are not going to come to us and pick up technology. We have to go.
Dad will die with that flip phone in his hand if you let him. But I do think, even with my own parents, there are things that they are starting to use technology for that are helpful. And I think, and going to what you said earlier, we have to move at their pace, because otherwise you're not going to see the adoption of things that could really be helpful for families.
What is the advice would you give for the leaders and the entrepreneurs who are embarking in this journey?
I think the best thing that we can do is listen. I think that so many times we just see opportunity and we move. And I think throughout the journey of this tech growth, we have to stop and listen to the people who are impacted by it, the caregivers, the patients themselves, their extended family, and make sure that we don't get too far down a road that isn't helpful. Because there's so many cool things that technology can do. Doesn't necessarily mean it's beneficial. So really being thoughtful and listening to the people who are impacted by your programs so that you are really being efficient and effective with your design.
Thank you very much for that advice. And as we come to a conclusion for this podcast, I would love to ask one open question, and it is truly open. It's your 90 seconds. If we have missed something critical that I missed on asking, or if you think that there is something very important that you want to reiterate, whatever it is, it's your question. And I say 90 seconds, but if you take 4 minutes, you're fine.
I go back to, there's an old Rosalind Carter quote that says, but at some point in time, everybody is going to be a caregiver, need a caregiver, or be supporting a caregiver. There's just, the reality is, I think, and this really is what our protocols are based on, is identity discrepancy theory. So many times, the people that we work with professionally don't even think of themselves as caregivers. And so that, you had asked earlier, like, what is one of the barriers? And that is one of the barriers, that because we don't think about ourselves as caregivers, we sometimes don't respect ourselves. We don't give ourselves the level of respect and support that we need, whether that's self-support or support from external. And so people bringing solutions to this field need to understand that. There aren't people with signs, I'm a caregiver, help me. And we have to be creative with how we support people and accepting and embracing their caregiver identities. And so many people who even will listen to this podcast won't even think of themselves as a caregiver, but you probably are. And it's that change in mindset that helps you give yourself grace and helps you invite the support of others and helps you think about what are things that I can do to make my caregiving journey easier so that it isn't overwhelming and that it doesn't take away from other important areas of your life, but instead it supplements it, and it brings that, and you see that caregiving function as bringing value, not being a struggle, so to speak.
So that's a big task for TCARE, and there is a huge educational necessity on that part. Thank you for sharing that.
Thank you. Thank you for having me today. I appreciate it.
And I 100% appreciate it.